Like most pediatricians, Sangamitra Misra will tell you tears are part of the job. These families are lined up to see a doctor in the parking lot of an elementary school near downtown Houston.
The concept of the mobile clinic has really expanded over the last 5 or 10 years. Everyone is thinking of how can we actually get to the families that need help, and it just makes sense.
Many parents are bringing their kids for a regular checkup. For some schools in the district, 30 to 40% of students are behind on their shots.
We have very open arms and we're ready to really help the families that need our services.
This mobile health clinic is headed out to that particular neighborhood very much by design.
I'm a health economist, so I like to optimize resources.
With support from the National Science Foundation, Rigoberto Delgado wants to help providers like Texas Children's Hospital target their limited resources where they can do the most good.
Dr. Misra is busy concentrating on her patients. She has no time to look at whether she's going to the right places or not. We're trying to complement her services by providing the basis for an objective deployment of our resources.
His team at the University of Texas Health Science Center, Houston, is doing that by looking at public health data and using geospatial mapping science and predictive analytics to forecast areas of highest risk for disease outbreaks. On this map, the red dots show where the fleet of mobile health clinics routinely visits.
But you can see there's pockets here where it needs to cover more. Not that they're doing a bad job, but they might need more resources or deployed their resources in a different manner.
Okay, come.
Dr. Misra says she welcomes a more numbers-based approach to deciding locations.
Some days we show up, there's 75 children. Some days we show up, there's 5. And so I think this would normalize it a little bit if we knew that there was a certain number of children that really we knew needed our services.
With more demographic data, the Houston team says this approach could be helpful in underserved communities around the world. I'm Faith Lapidus, VOA News.